every breath you take.
Every breath we take depends on our airway staying open. So what happens when something blocks it? When it bleeds, collapses, or just doesn't look right? Today, we are diving into bronchoscopy, one of the coolest procedures in respiratory medicine. In the next few minutes, we'll cover what actually happens during a bronchoscopy and why the patients need this procedure. But first, let's enter the lungs. Air enters through the mouth and nose, travels through the pharynx, down the trachea, then splits into the right and left bronchi, which divide again into smaller bronchioles until it finally reaches the alveoli, these tiny air sacs where oxygen enters the blood. Sounds simple, but this system is everything. Talking, sleeping, running, laughing, living. Even small swelling, mucus, dry air, or irritation can make breathing harder. And if the airway becomes blocked, no oxygen gets through. Organs begin to fail. That's why in emergencies, healthcare professionals always check the airway first, because no airway means no life. Now, let's quickly travel back in time to find out how bronchoscopy started. In 1897, a doctor called Gustav Killian did something unbelievable. He saw that a man was choking on a bone that was lodged deep in his airway, and Killian used a long metal tube to remove it. That moment became the birth of bronchoscopy. Today, bronchoscopy is way more advanced. Doctors use a flexible camera called a bronchoscope to travel directly inside the lungs. This helps doctors find problems, take biopsies, remove mucus, clear blockages, investigate infections, and monitor chronic lung disease. This intervention is used when doctors need answers fast. In cystic fibrosis, thick mucus can clog the lungs. In cancer, doctors have to inspect suspicious areas and take biopsies. Lung transplant patients need monitoring for healing, rejection, or infection. In suspicion bleeding in the airway, doctors need to find the source. And yes, sometimes people inhale things like peanuts, beans, or food. Basically, when scans don't tell the full story, bronchoscopy steps in. With a bronchoscopy, doctors can see and collect samples deep inside the lungs. The scope is a device packed with technology. At the tip, there is a camera and light, so we can watch everything live on a screen. Inside, there are channels for tools, so we can use instruments like brushes, needles, and biopsy forceps. There is also suction to remove mucus. The scope is gentle enough for delicate airways, but powerful enough to grab samples and clear blockages. To perform bronchoscopy safely, the team needs suction tubing, local anesthetic spray, saline, oxygen, monitoring equipment, and of course, a fully trained team. Once the scope is inside the lungs, the procedure itself usually takes about 20 to 30 minutes, but complex procedures can last more than an hour. Most patients get sedation to help them relax, but some procedures are done under general anesthetic. The bronchoscope goes through the nose or mouth, down the throat, into the trachea, and deep into the bronchi. Doctors control the scope almost like a joystick. They look for swelling, tumors, bleeding, mucus, or infection, and perform treatments in real time. After the procedure, patients recover from the sedation, while the throat numbness wears off. They are advised not to eat or drink until the gag reflex returns, which usually takes about 1 to 2 hours. A mild sore throat, cough, or hoarse voice is completely normal, and if biopsies were taken, a tiny bit of blood in the cough can happen too. Most patients go home the same day. Serious complications like heavy bleeding or breathing problems are rare, and patients are monitored closely before discharge. So that's bronchoscopy for you. From a life-saving procedure back in 1897 to a modern high-tech airway investigation today, bronchoscopy remains one of the most important tools in respiratory medicine. And remember, oxygen is the greatest free gift on earth. It is everywhere. It powers every cell in our body and every breath, keeping us alive. So go on, take a deep breath and fill yourself with energy.